I'm going to take you through something about what sickle cell disease is, how does it present, and how can we prevent it. Sickle cell disease is one of the hemolytic diseases. By this I mean diseases of blood, diseases that affect blood. And now here specifically we are going to be talking about red blood cells. We all know in our body red blood cells are responsible for circulating oxygen all over the body. And now this means that in case somebody is having sickle cell disease, we are going to find that there's going to be low oxygen supply all over the body. How does this sickle cell come about? Sickle cell is a genetic disease, which means that it comes about genetic coding. By this I mean it can't be just picked, it can't be transmitted communically. So this means that sickle cell disease, it is born with it. A child is born with it, and it is genetic, like it can be transferred from mother the child. Now a change in the shape of the cells come about in the formation of these blood cells. Genetically there is substitution, there is substitution of glutamic acid to valine at position 6 of the beta globin polypeptide chain. And now this means that we are going to form cells which are actually different from abnormal polypeptide chains that actually are going to later make hemoglobin S. Hemoglobin S, this one expresses itself in a recessive form. It means it can't express out itself symptomatically to anybody, or you can't identify it if it is in the recessive form. But if this person happens to have these recessive alleles homozygous, or if they express themselves homozygously, it means a person is now going to develop the symptoms. Let us first go into the symptoms. How will you know that the person is having sickle cell? These people are going to be having, first of all, we shall have hypoxia. It means that there's going to be a tissue perfusion. It means that little oxygen is going to be supplied to areas which actually need oxygen. Second of all, there will be acidosis. It means the blood will be more of acidic. It means it's having more of carbon dioxide. And then also, if infection is setting, a person is going to experience something which is called crisis. This is the painful feeling like somebody is going to receive because of failure of blood to reach the required ends. Because remember, in infection we need a lot of oxygen for these blood cells to fight. So this crisis is going to come as a result. Maybe it may be vaso-occlusive crisis. It means that the blood vessels, the outside blood vessels, have been blocked by these sickle cells because they can't be transmitted through the blood normally. So in different systems, we are going to have the systems as actually you are seeing on the screen, each system with its problem. So I don't want to leave you minus you knowing how we can manage sickle cell disease. Sickle cell disease, first of all, it's something that we can't eradicate completely unless we do bone marrow transplant, which is really expensive, and also it is really rarely done. So these are some of the ways we use to manage sickle cell. First of all, we have transfusion. We give you blood which is normal so that it can support your blood as you are going through this crisis. Second of all, we treat people with folic acid. This helps them to form blood, and then also now there is a new tablet which actually is now like new medication which actually has been recommended, hydroxyurea. With hydroxyurea you are able to move on with your sickle cell, but you are not actually experiencing these symptoms. Prevention. The first way to prevent this sickle cell, first of all, is to test yourself before marriage. Test your partner, see that nobody of you is having the allele or this sickle cell gene. So if you are both carriers, please don't